So now I'll be talking about the effects of Alzheimer's disease on the peripheral nervous system. And this next point sort of goes along with the nervous system as a whole. It could be part of the central nervous system slide as well. But there's a reduced production of certain neurotransmitters due to Alzheimer's disease. And as we know, neurotransmitters are chemical communication throughout the nervous system. And it's important to note that there's a significant reduction in neurotransmitters like glutamate and serotonin, which have their specific effects on our behavior. But a big one to think about, and that has the most clinical backing within the literature surrounding Alzheimer's disease, is the reduction of production and basic I guess, proper functioning of acetylcholine. So acetylcholine is used throughout the body for many purposes, and it's also really important for learning and memory and the consolidation and formation of memories within our neural processes. So yeah, the reduction of acetylcholine really affects the memory of Alzheimer's patients, and it's seen as one of the key factors of Alzheimer's disease breakdown of communication within our nervous system as a whole. So also the peripheral nervous system response to injury or any sort of like bodily threat is significantly reduced with Alzheimer's disease, and this is partly due to this general decline in our PNS responses, our sympathetic and parasympathetic nervous systems with age. And as we know, though, Alzheimer's disease we'll see more significant and rapid progression of this loss of response. And so this can be dangerous for patients because they might not be able to respond quickly to the fact that they have sustained an injury, and there are many common injuries that occur comorbidly with Alzheimer's, or that can occur comorbidly with Alzheimer's due to the effects of aging. So these can include anywhere from like more outward injuries to like fractures within more frail bones and higher risk for bleeding and hematomas. So so it's a really important one to note, because you'll have to remember with Alzheimer's patients that they might not respond to injuries in the same way as a healthy functioning patient. Another effect of Alzheimer's on the peripheral nervous system is the degeneration of myelin sheaths around the axons of the nerves in the peripheral nervous system. So as can be seen also in the central nervous system, and also pointedly in the picture of the brain that we saw on the previous slide, there's a loss of the fatty coatings around the nerve cell axons, and these myelin sheaths, the fatty coatings, they'll help communication and helping the messages between the nerve cells transmit more clearly and faster and without any interruption. And without these myelin sheaths, we'll see the breakdown of communication between cells, and also it exposes the cell to more rapid death and degeneration due to the loss of this myelin sheath. So also our peripheral nerves will in general, because of this communication slowdown, we'll have more slow reactions in our behaviors, so I would include slower reflexes in older adults or older adults with Alzheimer's, and also decreased sensation throughout your body. So, and this will be especially noticed in extremities and trying to obtain distal sensations throughout the body with Alzheimer's patients.